Greetings, good afternoon, and welcome to the podium coming to you live from the Sierra Leone Broadcasting Corporation. My name is Zulayatu Hamid. A photo for today comes from Jennifer Williams, and it says oral health is just as important as getting a regular and physical check. It's not just about getting a cavity filled, it's about the overall health of an individual. Oral Health Day is observed annually on the 20th March to raise a global awareness on the issues around oral health and the importance of oral hygiene so that governments, health associations and general public can work together to achieve healthier mouths and happier lives. Of the world's population, 90% will suffer from oral diseases in their lifetime. In Sierra Leone, the Oral Health Department under the Ministry of Health is still not capacitated to respond to the growing needs of the oral health. The theme is Be Proud of Your Mouth to inspire change by focusing on the importance of oral health and the overall health. Well, for more on this, I have with me Dr. Ahmed Sharif, who is a dental surgeon from the Connaught Hospital. Good afternoon. Thank you for joining us on the podium.
Thank you very much for having me.
Yes, the world is celebrating Oral Health Day, and at first we were told or taught to wash our mouth 3 times a day, and that's not so common these days. So take us through the procedures now to properly take care of one's mouth.
Okay, the first and foremost, my name is Dr. Ahmed Al-Hassan Sharif, a graduate from Faculty of Oral and Dental Medicine, and currently working at the Connaught Hospital. So when we talk about the oral health and as regards to how you handle it, how you control it, dentists recommend you brush your mouth twice a day. In the morning, first thing in the morning, and the last thing before going to bed. So how do we go about it? Now we've already talked about when and the frequency. So you need to have a soft brush. Of course, a lot of people think when you have the strong brush, that's what cleanses the mouth, which is not the case. You use a soft one and you don't apply the hard force. You need to be very polite with it. And you use a toothpaste which has fluoride. Twice a day, first thing in the morning, the last thing before going to bed. That's regards to brushing. Secondly, you need to reduce the frequency of your sugar intake. Of course, people they take these sugary foods as and when they like, and that should not be the case. You need to reduce the number of times. It's better for you to eat a whole box of chocolate in one sitting than to eat 5 bars of chocolate at different times of the day. So you reduce your sugar intake. So we'll stop there for now and we'll talk more as we get along.
Okay, so now let's talk about tooth decay. That's common. You get to meet a lot of people and they go to the dentist and, I just want to extract this, I just want to take it out. So in terms of prevention before it gets to extraction, what should be the procedure?
Thank you. Somebody talked about toothbrush and brushing your teeth. So people need to understand that you don't only go to the dentist when you have pain. We don't like extracting tooth. You understand? Because the tooth is one of the most precious minerals, one of the most precious components you find in the body. So what do? The first thing, you don't have any problem, you need to see a dentist twice a year. Every 6 months, you see a dentist, let them examine you for checkup. And then, in case they see any problem, they'll be able to do something about it while it's still in its early stage before it gets worse. So even when that happens, now let's say there is something when a patient comes, what they do, we try to clean it and fill it up in an effort to preserve the tooth. Because like I tell you, the functions of the teeth are numerous. You use it for chewing. A lot of people think it's just for chewing. You use it, it helps in speech. It helps in your appearance. So because of all these things, removing the tooth is the last resort when there is nothing else to do. So let me just give you a brief background about the dental caries. How does it come about? Of course, we have microorganisms in our mouth. Bacteria will say germs them. So when you eat a sugary food, the microorganism with the bacteria, they act on the sugar and convert it to an acid. So it is that acid that demineralizes. Of course, you know that the tooth is a mineral. So it demineralizes the tooth and then gets a small hole, and the bacteria colonize that location and they act continuously for a period of time it leads to a decay. And the longer it takes, the more it goes until it reaches a point wherein you start getting the sensitivity. So it's a long period. Sometimes it takes 3 years, it takes 5 years. So by the time you feel the pain, it's already late, which is why you need to go to a dentist whether you have pain or not every 6 months.
Okay, let's go now to gum disease. Tell us about it.
Okay, so gum disease, technically we call it gingivitis. You call the gum the gingiva, and when it's inflamed, you call it gingivitis. It comes back to the toothbrushing, which we talked about. When you eat food, after eating, you have the remaining, which sticks to the teeth. It sticks there, which is, it makes it very, conducive for microorganisms. I talked about the bacteria to act on it. Sometimes the food itself can gather between the tooth and the gum, and it stays there. The bacteria colonize there, they stay there, and because of their actions, it causes an infection. The gum becomes inflamed. When it becomes inflamed now, that's when the patient say, hey, something is wrong. But you can prevent this by brushing your teeth twice a day. But in this case, when the patient comes to us, we clean it up and we give them some medications. Unfortunately, however, a lot of patients do not come until when it gets out of hand. Now you see them coming with a swollen jaw or swollen face, and now it becomes a bit difficult. But even at that, we try our best to see how we can get them to normalcy again.
Okay, so can you please make sense of it? There are times somebody washes their mouth and they get to experience that they spit out blood. So what are some of the causes for that?
Okay, now it comes back to the gum being inflamed. When the gum is normal, or the gingiva and it's normal, it doesn't get inflamed. But because the bacteria have been there is an infection, they are acting on the gum. So when you come now, you brush your teeth, then the blood starts coming out. But if you brush your teeth twice a day, you see a dentist every 6 months, a lot of these problems can be prevented.
And the first thing, local remedies, they get to tell you when you experience some of these occurrences, they get to tell you, go and wash your mouth with salt and lukewarm water. So is that correct?
Well, yeah, that helps, but you don't take a shortcut. Sometimes you need to get the advice from where it's supposed to come from, because you also have cases where they will tell you you need to put ash. They tell you put ash inside water using water. You need to make sure you are getting this advice from a qualified and certified individual. It should not be a public opinion. So of course the lukewarm water and salt helps, but make sure that advice is coming from a dental practitioner. Okay,
so the issue now of cat and broken tooth, what would you say in terms of that?
Okay, well, in that case, it could be as a result of trauma. Maybe people were involved in a fight and someone gets punched, or you just hit your face somewhere, or let's say when people get in the road traffic accident, that's where we normally see most of these cases. But then you also have people who they have bad oral habits. When we say bad oral habits, what are we talking about? You see people opening the bottle of the soft drink with their teeth. So that can lead to you inflicting trauma on the tooth. That's one. And then we talked about the road traffic accident and the other things. So this happens. But the advice is you should not do some of these things. And you also have people who use toothpick. They put toothpick in the mouth, and repeatedly this causes the problem. So these are things that should be avoided. But there are situations that are unavoidable. But when this comes, you need to report to a health professional as soon as possible.
Okay, so tell us about your activities or your operations at the Connaught Hospital.
Okay, here at Connaught, the first thing we do, we concentrate as well on the preventive aspect. You have preventive and curative. You need to concentrate on the preventive, because they tell you prevention is better than cure. So when you prevent yourself, first, when the patients come, we give them this advice, like what we are doing now, having these conversations. We used to have campaigns going to schools. We even have outreach programs going to provinces and other peripheral communities to get them to know what are some of these things. So that's the preventive aspect. So when you come now, let's say somebody has a problem, we have feelings. Now, you don't just come and you remove the tooth, like I said. You clean it up and then you fill it up with materials first to prevent and protect the tooth. Now, if this doesn't work, you have advanced procedures. Now it has gone a little bit deeper. You can use the root canal treatment. Now it has gone really deep. that can be done. We also have cases where people from the road traffic accidents, we get them every day. You get 5, 6 of them, they are coming. So these ones you have to operate on them. You carry out the surgeries, so as to, sometimes people come with broken jaws, broken dental arches. You try to immobilize them, you put them together, and then you give them medications until they recover. So these are just some of the activities that are there, that are ongoing. As regards to others as well, like we talked about the cleaning, we call it scaling, but you can just say cleaning of the mouth every 6 months, because the toothbrush cannot remove all the things that cling to the tooth. Sometimes you need a professional dental hygiene for those things to be removed. So we also have these procedures, we call them scaling. So this is just a brief.
How often would you advise someone to change their toothbrush particularly?
Good. So contrary to normal beliefs, your toothbrush should be changed every 2 months. Every 2 months you should change your toothbrush. That's one. But before that, you need to be mindful of where you keep your toothbrush. You find people, they brush their teeth and they just drop it. Now you are dropping your toothbrush on this table, you're collecting microorganisms and you're going to put them back in your mouth. You leave your toothbrush on top of the sink. You are taking your bath, the dirt is coming from your body to the toothbrush. You are putting your toothbrush, you put it inside the supply, So the thing you are using to brush your body is mixing up with the toothbrush and you are putting back in your mouth. So you get your toothbrush, make sure you get the one that has a container. When you're done, you put it inside. Some people prefer to put it in the freezer. If you have a freezer, you get a corner, you put your toothbrush there. And every 2 months, you change it.
Okay, let's go now to, back then we used to hear a lot of stories of people who go to the Far East, such as Calabar town, to extract their tooth, and they get to go through some rigorous pain. At the end of the day, they have to come back to you at the Connaught Hospital or the school dental clinic, and their faces are most times swollen and all. So what's the procedure when it reaches to that point?
We even had a case yesterday. So these things are going on. Even along the Abacha street, you have these women who they tell you, we can do it for you. And sometimes they do certain procedures, they get it wrong, and they only refer the patient when it has gone, out of hand. Somebody will try to extract a person's tooth and it gets broken, and they will leave it. Now they are coming with a swollen jaw. So the advice is, when you have any issue with your tooth, don't discuss it with anyone except a professional. Just discuss it. I'm not even talking about the procedure yet. You should get an advice from a professional. You should get a treatment from a professional. Sometimes some people talk about the cost, but when you come earlier, it's very cheap. It's almost nothing. But by the time it gets to an advanced period, sometimes it's hard for you to even, handle some of these costs. So avoid these quacks. Make sure you get your treatment from a certified dental practitioner.
And it's wrong to buy those medicines. You get to go to Abacha Street, as you name them. They get to sell all of these items that they tell you, if you take them, it will be better. It will stop the pain and stop.
Yes, of course. You have someone, they come now with a swollen jaw. There was somebody who had a dental pain and didn't report until it was 1 year, 3 months. By the time they reported, they had a swelling, an abscess here, or we can say a swelling that came down up to the chest. So can you imagine something like that? And people have the habit, when they have this problem, they tell you put relief, they break the tablet and they put it inside the tooth. That's not helping. So you have to come. The bacteria are the ones causing that problem. They have to be removed. The tooth has to be cleaned and covered. That's how it's supposed to be. But when you are putting other things inside, you are making the environment more conducive for these microorganisms that have caused the disease from the beginning to take their activities even further. So these are things that should be avoided.
Okay, let's go now to your awareness that you made mention that you take to schools particularly. Tell us about some of the operations you've done.
Well, of course, I haven't been here for a long time. I just came back some months back. But from the background that I got is they've been to a number of schools within Freetown. They normally, for example, on days or weeks like this, for sure now we have the World Oral Health Week. Every day We have people who go to different schools to pass on the message. And then we have a team now of specialists, a team of professionals who go to communities. Like now we are saying, some people, you can understand, it's hard for them to come all the way. They don't have the money for transportation, some can't afford. So with the leadership there at the Oral Health Department, Dr. David Idris Kamar and the rest of the team, they've been making these efforts so as to be organizing these free camps to these communities to get them aware and to treat them. And sometimes advanced cases, they refer them to come back. So more on that, we just launched 2 centers. Of course, most of the dental care is here in Freetown, which the leadership there at the Oral Health Department is trying to change. Just 2 weeks back, they've opened a dental clinic there at Moyamba, and there is an ongoing one now in Cambia, and very soon Kono and Kenema will be getting their own centers opening up. So these are all the efforts that are being taken to bring dental, affordable, accessible dental care to each and every Sierra Leonean.
Okay, what would you advise to somebody who has severe mouth odor and it's as if it just can't go, and people get to say all sorts of things that, oh, that person, that's just how the way they are?
Yeah, that's something which is very difficult, and sometimes, unfortunately, even the people do not get to realize. So what happens in this place, before talking about what you do for them, you need to ask, what is the cause? You need to know what is the cause first. Sometimes it's caused by poor oral hygiene. People are not brushing their mouth, they are not brushing their teeth as they are supposed to. That's one reason. It could be also as a result of systemic conditions. Sometimes somebody has a problem, whether it's in the stomach or with the liver. So as a dentist, when you identify a situation like this, you try to investigate the cause and then you try to give them the necessary treatment. So when somebody has a mouth odor, let them report as soon as possible. You should not be shy about it, which is very normal. So they have to come. Smoking causes they call it bad breath. In dentistry we call it halitosis, but for the general term it's bad breath. Smoking causes. We have a number of factors, but the point is, when somebody has the problem, they need to report as soon as possible.
Okay, what about the local stuff that people get to use, the chew stick, the ash that you made mention? For those in the provinces, is it necessary or is it advisable to use them?
Well, there have been studies that have been supporting the chew stick, that it has some of the ingredients which we find in the toothpaste, so it's supported. And even there are certain religious beliefs, for example, Muslims will tell you it's part of the culture. So but it has been proven scientifically that it has benefits. So if someone cannot afford a toothbrush, then they can use the toothpick. We talk about the chewing stick. Okay. Yes, they can use it. It can help them. But sometimes always good. Combination of both always works. You have people who use the chewing stick, for example, when they want to pray or when they've eaten food, and then they brush their teeth in the morning and at night. So you can combine it, and if you can't afford, then I think the chewing stick can be a point to start.
Okay, how many tooth can somebody extract for a day? Because the last time I spoke to somebody and he said he was afraid to go to the dentist because he lost his friend who removed teeth on the very same day.
Well, you can remove 5, 6, 7, 8 teeth. You can remove 8 teeth in a whole arc with nothing happening to you. But the point is, the person needs to know what they're doing.
Okay.
That's the thing. Because the very important aspect in dentistry, before they teach you how to extract a tooth or how to remove a tooth, they tell you first the complications, what goes wrong and how to handle it. So some people think it's just to hold something and remove the tooth. But what happens if something goes wrong? Whenever, as a dentist, whenever I extract a tooth, I have instructions which I give the patient. I have medications which I give them. So now I'm preventing something. But now you find somebody there using an unsterilized instrument, extracts a tooth, and then they have nothing to tell the patient, they have no medications to give them. When something goes wrong now, it becomes a problem. So you can remove one tooth, just one tooth, and get a problem. If the person is not qualified, you can remove as many teeth as possible with nothing happening. Okay. So it's more about the know-how.
There have been major improvements in the world of dentistry now, and people get to say that it's not as painful as it was back then when somebody goes to extract their tooth. So take us through the challenges and the successes so far.
Okay, well, of course we have individual variations. you have people whose teeth are stronger than others. And you can find even within one patient, there are some teeth, for example, the anterior teeth, the teeth that we have, for example, the incisors, the teeth that we have in the front of the mouth, you can say easier to extract. Whereas the teeth at the back are a little bit more difficult. It needs a little bit more technicality, a little bit more of stamina. You understand? So sometimes it can be difficult, sometimes it can be easy. Whatever the case, it should not be a problem. They give you the anesthesia so that you don't feel the pain, and the tooth can be extracted uneventfully. So I don't think anybody should be afraid of extracting a tooth. But really, if somebody is afraid of extracting a tooth, then they should do the things that are necessary so that they don't even get to the point of having to extract a tooth.
Okay, thank you very much for talking to us. He is Dr. Ahmed Sheikh. He is a dental surgeon, Connaught Hospital. Welcome back. This is The Podium, coming to you live from the Sierra Leone Broadcasting Corporation. You can be part of the program by sending in your text to the number 088-373-504, 088-373-504. Now, I still have with me Dr. Ahmed Sheikh, who is a dental surgeon, Connaught Hospital. Finally, as we round up on World Oral Health Day, what would you advise anyone who is smoking, particularly, to ensure that they have a proper breath?
Okay, well, for smoking, the harm is not only the bad breath. Smoking leads to oral cancers. It leads to cancer. So people should try as much as possible to deviate from it. But generally, if we say, I would just advise that they brush their teeth regularly, like we said, twice a day, and they should try as much as possible to deviate from it, because it leads to oral cancer. You see patients come with a swollen jaw, and this one is not an abscess, not a normal swelling with pus inside, but a hard mass which can lead to their death. So it's that risky. They should stay away from it, as well as alcohol. Yeah.
Thank you very much for talking to us. I will end this edition of The Podium. Remind your quote for today comes from Jennifer Williams, and it says, oral health is just as important as regular and physical health. It's not just about getting a cavity filled, it's about the overall health of an individual. Many thanks to my producer, Salma Taba. My name is Zulai. Have a lovely weekend. Bye-bye.